For Module 9 on Gender and Health, we are going to cover subtopics: risks for health, gender inequality on women's health, gender norms on men's health. Gender, as a review, refers to the characteristics of women, men, girls, and boys that are socially constructed. By this concept, we mean that this includes norms, behaviors, and roles associated with being a woman, man, girl, or boy, as well as relationships with each other. As a social construct, gender varies from society and to society and can change over time. Gender and sex are related to but different from gender identity. So this is a person's deeply felt internal and individual experience of gender and may or may not correspond to the person's physiology or designated sex at birth. So you may hear a woman say she is trapped in a man's body, and a man would say that he is trapped in a woman's body. Gender influences people's experience of and access to health care. How health services are organized and provided can either limit or enable a person's access to healthcare information, support, and services, and the outcome of those encounters. In the Philippines, we have this healthcare delivery system at the national level. We have the DOH. Down to the provincial level, we have at the provincial level, that's why we have provincial hospitals. And local government unit level, city, municipal, we have city hospitals, city health center, where you'll find a doctor, a nurse, a midwife, and the volunteer barangay health workers. At the barangay level, we have the so-called barangay health station, where you'll find a midwife and a BHW, where there's barangay health posts. So it is where women at the barangay level would go into for prenatal. And when there is a child born, for immunization. And the days of the week are assigned to various purposes at the barangay health station. I remember immunization is scheduled on a Wednesday. Risk for health and well-being. When there is restrictions on mobility, imagine your disease or illness is just simple, but there is no transport. So you could die on that simple illness. So you are bleeding and you will bleed to death because you get to walk kilometers before you reach a health station. The lack of access to decision making power. Of course, somebody has to decide for the one who is ill and can't decide for himself or herself. But, decision making is very dependent on budget as well. Lower literacy rates because it will render somebody uh, an ability to read instructions or even understand or comprehend. Discriminatory attitudes of communities and healthcare providers, especially for those um, in the hinterlands, or we call those also who are considered as indigenous peoples. There is lack of training and awareness among healthcare providers and health systems of the specific health needs and challenges of women and girls. There are diseases and illnesses which are only experienced by women and girls because of their reproductive systems. That's why we have obstetricians, we have gynecologists who are doctors for women, specializing for women. Gender inequality and discrimination faced by women and girls will render them at risk for their health and well being. So these are the health risks for women and girls: unintended pregnancies, sexually transmitted infections that include HIV or human deficiency virus, which could lead to AIDS or the autoimmune deficiency syndrome. So look at this life-giving organ where the baby is housed for 9 months. It gives life, but it may be subjected to multiple or various illnesses for women, like the cervical cancer in here. So there is malnutrition for the girls and or women, lower vision, respiratory infections, and even elder abuse. So gender inequality could lead to high levels of violence among girls and women because of course some men may consider themselves as strong and are the primary the kings of the household. So that would lead to violence among girls and women's female genital mutilation to preserve virginity or something. And there is child or early and forced marriage. So it's either child marriage, early marriage, or forced marriage, which is very detrimental to women's health because there will be very early pregnancy. So WHO or the World Health Organization recorded that about 1 in 3 women worldwide have experienced either physical and or sexual intimate partner violence or non-partner sexual violence in their lifetime. Now, gender norms for the men this time could lead to rigid notions of masculinity. This affects boys and men's health and well-being negatively, may encourage boys and men to smoke and take sexual and other health risk, which actually may affect if there is a STD passed by the man to the woman, then the woman gets pregnant. It could affect uh, the fetus upon birth. There will be the so-called congenital syphilis, which usually occurs following vertical transmission of this T. pallidum from the infected mother to the fetus in utero, but neonates may also be infected during passage through the infected birth canal at delivery. So I'm just showing this to you for awareness purposes. Now, gender norms, to continue, which rigid notions of masculinity may lead to misuse of alcohol and not seek help or health care among men, boys and men perpetrating violence, as well as being subjected to violence themselves by other boys. There is grave implications for their mental health in this. So in this figure in the Philippines, percent distribution of death by age, group, and sex, 2018, just 3 years ago, 2 to 3 years ago. So these are the females, these are the males. So you see, this there are similarly but more deaths among males, particularly here at the ages 60 to 69. Okay, so women live longer. Look at this. So they die 85 and over. Okay. More deaths in males than females. 134 male deaths for every 100 female deaths. That's the ratio. So there are 34 more males. Percent distribution of maternal deaths by residence or region in our country. So you see, this is in region 4A. with the highest death percentage. So I'm just showing this to you because there is the so-called maternal deaths that is be- for being a woman, okay? For being a mother, actually, because the maternal deaths are caused by being a mother. So causes of maternal death worldwide can be this: severe bleeding, okay, with the highest, followed by indirect causes, and all this unsafe abortion, infection, eclampsia, obstructed labor. Okay, 10 leading causes of death. We have here as top one the ischemic heart disease. For males, there are 53,000 or 15.7% compared to females, which are just 14%, but it's very slight difference. So many died. Top one, okay? Ischemic heart disease. Take care of your heart. Valentine's Day is fast approaching. So second is neoplasms, cancers. For males, 8.9%. There are really many more females who had cancer because there is the gynecological cancers, cervical cancer, breast cancer, and men don't have that. And this is followed by cerebrovascular diseases, okay? And mga high blood people may have stroke. And then, of course, the lungs, pneumonia, and then those who are lovers of sweets, soft drinks, cakes, chocolates, so diabetes mellitus, hypertensive diseases, chronic lower respiratory infections. So lungs again, lungs, respiratory tuberculosis, other heart diseases, okay? And then this is genitourinary system, those in dialysis, but of course, this is usually the outcome of the diseases that are this diabetes mellitus may end up to dialysis, genitourinary system. So you see, these are important vital organs, the vital organs of the body, in which if you are going to take care on each of them, take care, feed yourself healthy, exercise, sleep well, have sunshine, drink lots of water, something like that. If you're going to do all those things, so you can take care of these vital organs and you may live healthier and longer.